This is the 8th section on the discussion on fourth generation photodynamic therapy. These are MRI scans from a multiple sclerosis patient. I don't know if you're familiar with this, but multiple sclerosis, you eventually lose the ability to talk and to walk, and you wind up in a wheelchair, then you wind up in a bed, then you wind up in a mortuary. This patient came to us. She could only go a few feet without leaning on something. And when you spoke to her, her head turned very slowly. It took like a full 20 seconds for her to turn her head and to begin to respond. The treatment on this is very interesting because we decided that we could treat the immune system, which is flowing around in the blood, directly by treating the skin, because all of the blood eventually comes to the surface of the skin about every 3 to 5 minutes, depending on your level of activity. So we fed the sensitizer in at a slow rate to maintain the concentration that we wanted, and then just shine a laser over the patient's exposed skin. We started with the chest and the back, and gradually moving the laser slowly along. Resets the immune system. It's really quite incredible because I went to see this patient a week later. When I arrived at their house, this woman comes to the door and says hi, and I'm looking at her and thinking, geez, she must have a twin sister because that certainly looks like her, but she doesn't have any symptoms at all. She's moving rapidly, she's standing upright, she's not needing any assistance. What's going on? And I eventually, after following around her house for a while, I asked her if she was my patient or if she was a twin, and she said, no, I'm the person you treated. And I said, why didn't you tell me what had happened? And she said, well, we were afraid to hope that it was actually true. And I said, well, we'll keep following you for years and years to see how you go, but obviously you're fine. She had a scan a little while later, and as you can see in the scan beforehand, if you see these white arrows, those are going to what's known as flares. These abnormal flares are the ones that are not part of the section of the brain that normally shows up with the sensitizer. The black arrows are going to what's known as black holes. Those are areas of brain tissue that are already dead. The white ones are areas that are under attack. A month later, she had an MRI scan, and there weren't any flares. These are not Hawking's fingers that you see in MS. That's just normal accumulation due to the circulation of the brain. And the black holes have pretty much resolved. Her neurologist said, I don't know what you've done, but you should continue doing it if it ever comes back, because we can't do anything like this. That's been, 8 years ago, maybe 9. And she's still completely active, has gone back to singing, is driving and using the computer, has no problems. What else can you do with autoimmune disorders? Well, this is scleroderma. It's a hardening of the skin. Unfortunately, this goes down into the body eventually and attacks the lungs, the liver, the kidneys, and then you die. This patient was treated for years by the best dermatologist available in Oceania, and they couldn't stop it. They could control it so it didn't grow quite as fast by putting curved needles all around it and injecting cortisone into it. We treated her with PDT. If you look at the area on the left, all of this is hard. It's like plastic planted under the skin. You can't bend it. If you try to move it like skin, it doesn't fold up like skin. This photo is about 3 or 4 weeks later. There was a degree of something that looked like a sunburn, which eventually went away. The hair regrew. Everything went to normal. That's been, again, actually that was longer, so that was probably 10 years ago. And they're in complete remission. In the next section, we'll continue on with autoimmune disorders and how they can be managed.